Hello, I'm Dr. Beth Goethe.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Well, Dr. Goethe, I have a question for you.
Okay.
Let's talk about the stages of dementia. And there are a couple of errors in there that we can start with.
Well, of course, the first problem is the word dementia. And if you've been watching our sessions here, you know that dementia is a very broad term. And Alzheimer's is a type of dementia. And there's there's dementia that goes with Parkinson's disease or people who have had major head injuries. So the term dementia can't be used for everything, so it's very general. The other problem with that we both have this problem with trying to stage dementia, because it presumes that the progression of a degenerative type of dementia, that is a dementia that gets worse and worse and there's no cure for it, that the stages and the progression are the same for every patient. And they are not. And the other presumption is that you can categorize all kinds of behaviors at the same stage, so that all of the behaviors, memory, thinking and reasoning, speech and language, visual perception, all of those are at a mild level and then progress to a moderate level.
Together.
And then together at the same rate. And that's not really the case.
Now, we need to say that there are some very carefully crafted tools that stage dementia. They're used a lot of times for research. There are many uses for them. One of them is called the Geriatric Dementia Rating Scale, and different ones. You know all those better than I do. But they, not to say that they're not accurate and useful in some contexts, but for a patient coming in, or a family coming in for a particular patient and care for that patient, they've even recognized it. Usually by the time they come in, they'll say, I'm looking at this stages of Alzheimer's, and Dad is a stage 1 on this and a stage 2 on this, and he's a stage 4 on this because he's incontinent. Well, when we realize that he's got a urinary tract infection and that's the incontinence, that changes the staging. You can't make it fit everything.
Right. And in fact, most facilities, dementia care facilities, will have some sort of staging tool. That's a good way to put it, or questionnaire, checklist kind of thing, because they use that. You have to understand, though, that they use that in terms of how many hours of care people will need, so that they've discovered that when people are in stage 3 or 4, they'll need more hours of a caregiver's help than someone who's in an earlier stage. That's a big generalization, but it's one way that they use to have some sort of formula to determine caregiver assistance. And we could talk about the fallacy of using that kind of formula to determine the level of care, but regardless, that's where a lot of the staging comes along, that when you start to place your loved one, they want to know just how bad the person is, so they know what level of care that they're needing.
The other thing staging can be kind of helpful with is if you have a particular patient or person in mind, and you look at the functionality in different areas, functioning independently, driving, grooming, eating, planning, financial things, it gives you sort of a general idea and gives you some questions to ask, because you might not have even ever thought about, wow, I wonder if she can actually sort the laundry to do it. I mean, I know she knows how to do laundry, but now is she able to sort it to get it to where it belongs and that sort of thing. So you can look at a person's functional abilities across a lot of different areas and get some very general idea, is this early or middle or later stage Alzheimer's? And sometimes families, when they really look at those things critically, are very surprised to see how far along the disease is, because the person has been sociable and verbal and able to carry on a conversation, and these other deficits have been hidden by the person's social skills.
Exactly right. So that the person is able to carry on a wonderful conversation. They're usually clean and wearing clean clothes. They appear to be at a higher level than they actually are. And so really asking about functional abilities, that is, what can the person do day to day, is very important in trying to figure out what level of care they may need.
And there are side-along, I call them side-along functions. So, we may not be asking about whether or not a person can make a grocery list and follow it. The question might actually be, can they read a contract and sign it? But we know from the staging, if they can't make a grocery list and follow it, a similar cognitive task, such as reading a simple contract and following it, is not going to be possible either. So we can use some functions to kind of estimate someone's ability in another function, and that's just really part of the expertise of what we do and understanding how the brain works and how it progresses within that disease.
So when you're trying to figure out what stage your loved one is, think more in terms of functional abilities, not just, well, they seem to get along pretty well in social situations, but what can they actually do in their daily lives?
And I think that really echoes what we say over and over and over again. It's not the diagnosis, it's not the stage, it's not a lot of things, it's the functioning and how that works within the family unit and the context of that person's life. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.